Karibu katika Pango Asubuhi, katika Pango redio ambayo tunakupa unachohitaji, iwe ni habari, burudani, biashara na yote tisa. Kumi ni Momanyi hapo.
Tunawapea habari kuhusu vile.
My name is Malaka Imotano and my colleague presenter is
My name is Maurice Momanyi.
Katika ile hali ya kuendelea kukupasha, kukueleza mambo yanayoendelea hapa nchini. There are so many things that happen across the country and nobody even knew about it. Nobody even knows about them. We take them for granted. But did you know, starting with Momanyi here,
Yes.
did you know that Nairobi is proud to host or to have an eye hospital, the only one in East and Central Africa?
Yes.
Wanasemanga south of Sahara, north of Limpopo. We are glad today to have to be visited to host Dr. Wafula of Mama Lucy Kibaki Hospital.
Yes.
Feel welcome.
Thank you so much. As you did indicate, my name is Dr. Wafula, CEO Mama Lucy Hospital, and we are proud to be among the first eye public hospital in East and Central Africa.
Yeah.
And so far we are doing so well. And for the last 1 week after His Excellency the Governor launched it, we've seen so many patients. We are seeing up to 300 patients every day. We are operating over 50 surgeries every day. And we are really glad that this was a service that has been long waited for. And at least now Nairobians and Kenyans at large are able to access the eye care services.
Momanyi, imagine headlines like darkness to light, tales of eye vision restored at Mama Lucy Eye Hospital.
Yes.
What?
That is quite great. It's an achievement we have seen in the recent history in Nairobi and even in Kenya, because we are proud of our own. Because many of the hospitals people go to them in private, but now we have one of our own in Nairobi and in Kenya, a public eye hospital. That's a great achievement for us, and we thank the government of Nairobi for bringing up this hospital, and we want Daktari to tell us exactly what kind of service or what kind of operations or ailments or diseases we really cater for in that hospital.
In Mama Lucy Eye Hospital or Umoja 2, we take care of all eye ailments. We restore we restore sight to people who are blind. There are patients who come with glaucomas. There are those who come with eye cataracts. We operate on all patients. We are able to do intracornea injections. These are injections that majority of the patients who have retinal infections, they are not able to access it. So what we've done is at Mama Lucy Eye Hospital, we've put in ophthalmologists. We have 7 ophthalmologists there. On a normal day, when you come, you'll see, instead of now seeing a general practitioner, you'll be meeting with an ophthalmologist. The ophthalmologist will do the normal refraction of the eye, and then in case you have challenges that need operation, they book you for operation.
Yes.
We have, and the beauty about eye surgeries is once after the operation, the patient goes back home. That's the difference between eye operations and other operations. Immediately you operate on the patient, within 1 hour to 2 hours, you are able to discharge of the patient home. And we are seeing a lot of miracles where we are treating people up to age of, so far we've treated a patient of 95 years. This is a patient who was blind for over 52 years. But now the beauty about eye treatment is you get the results immediately. It's not an issue of go take some medications at home, then you come back. So apart from that, apart from the surgeries, we are able to admit the patients who, like now, if we are operating on children, because for children, we will not just come in and then operate. You want to admit them in the ward. We have 28 beds there. We also do lab works there. Additionally, we are able to we have a production unit for spectacles. So if a client needs spectacles, immediately gets a prescription from the doctor, then they just wait for 30 minutes. Within 30 minutes to 1 hour, they are able to go back home with their spectacles. So we are not waiting that someone has to go back and then say you'll come after 2 weeks or after 1 week. No. Once the doctor has given the prescription, we are ready to give the spectacles there and then. Apart from that, we have also put in optical services there. Optical services, that is, we have employed optometrists. Apart from now the ophthalmology, now the difference between ophthalmology and optometry, optometry literally deals with the eyesight only. You know, there are those people who are short-sighted, there are those who are presbyopia, there are those who are long-sighted. So the consultant who just looks at how to correct your eyesight is one we are calling the optometrist. So we've put in four optometrists there, so that then they can be able to sort all optical issues. And then we have also done two optometry technicians. The role of optometry technician is now to make the spectacle. Gets the lens, puts it in a frame, and then is able to give the patient. There are those people who want double lenses, so it is the role of optometry technician to ensure that if probably the patient has both short-sightedness and light, so the lens will be double. So whoever makes that double lens is the one we are calling the optometry technician. For the people who come with retinal issues, we put in a lens surgeon. This is called Dr. Judy, and as we speak in Kenya, there are only 14. So this is a really a rare specialization, but we've ensured that now at Mama Lucy Eye Hospital, the specialization is available. Now these are the doctors who operate behind the retina. They are able to open up the eye, go behind the retina. So if there is an infection, if there is a growth, if there is any malignancy, they are able to operate and manage the patient. So this is a complete unique area that His Excellency the Governor saw it fit that we get this done. Of course, people always ask themselves, what made us do so? When I joined Mama Lucy Hospital 2 months ago, there was a lot of congestion. And you know, with the congestion, you have to come up with plans to decongest the hospital. So one of the reasons why we decided to open the eye hospital was to decongest Mama Lucy Main Hospital. We were seeing, in a day, we were seeing 120 eye patients only. The whole hospital sees 3,000 patients per day. So with 3,000 patients, literally someone who comes to the hospital at 8 in the morning might leave the hospital in the evening. Because with 3,000 patients, that's completely a huge number. So what we are in our decongestion plan, one was to do the specialized centers, what you call the centers of excellence. So one of the centers of excellence that we've done is the eye hospital. And you can imagine, Manye is when we opened this hospital on the first day, we saw 600 people.
Wow.
We saw 600 people. And when we did the medical camp, we saw 5,000 Kenyans in 5 days. Operated on 329 Kenyans and restored their sight. So the motto of the hospital is Nairobi Free Blindness. Nairobi Blind Free County. So our role is to ensure that there are no blind people in Nairobi, and so far we are doing that. Apart from that, we have also finished an orthopedic center, orthopedic and trauma center, 38 bed capacity center of excellence with hip and joint replacement specializations. So the likes of Dr. Rono, I think you guys have been interacting with him, you've been seeing him. So Dr. Rono, Dr. Orwa, Dr. Sherry. Now those are our orthopedicians who have specialized in hip and joint replacement, and that's now that's the work that they are going to do. By next week on Tuesday, I will be installing a first 128 slice CT scan at Mama Lucy Hospital. So the reason again, so many Kenyans who need CT scan services they have been moving. You can imagine the entire of Eastland.
Yes.
The entire of Eastland, there is no CT scan.
No.
So all people who are coming from Babadogo, those who are coming from Kayole, those who are coming from Dandora, they have to go to KNH. They have to go to KNH or they have to go to KU. That's if they are looking for CT scan services in public. If they want to do someone wants to pay in a private facility, they go to Jamme, CBD, or they go to Sona. Now, all these Kenyans who are coming all the way from Thika, they have to travel all up to the CBD for them to get CT scan services. But then from next week, we are installing our 128 slice CT scan as one way of supplementing our radiology services. And the beauty about it is we have resident radiologists. Radiologist is a specialized doctor of reading and doing radiations. That is X-rays, MRIs, CT scan. They interpret then so that then the treating doctor can actually know what is the working diagnosis that they do. It's completely different from a radiographer. For a radiographer, their work is to take the image.
Yes.
For the radiologist, their work is to interpret the image and give the diagnosis of the patient. The other beauty about it is with radiologists, we are able to do some procedures. Like now we will do biopsy-guided ultrasounds. We're able to do very specialized ultrasounds, especially like for pediatrics. We're able to do skull ultrasounds. We're able to do small parts, soft parts. We're able to do the Dopplers for us to get to know whether the blood vessels are dilated well or they are blocked. So all these things now, we have the capability and we are now doing them at Mama Lucy Kibaki Hospital.
Blind-free Nairobi, but don't you say this is going to attract people from the other countries, from the rest of the country, and we will have the capacity to attend to handle this? Because I know during the launch, the 5,000 you are talking about, we are aware they came from all over Kenya.
Yes.
Do you have enough capacity?
We have enough capacity. As we speak now, money is that even the patients that we are seeing, the 300 patients we are seeing daily, we are getting so many, 40% of those patients are coming outside Nairobi. We are getting patients from Garissa. Remember, these are patients on a normal treatment. The cost of managing an eye cataract is between 120,000 to 180,000. Now, these Kenyans who are coming from Lodwar, Lodwar, Turkana, Garissa, those are eye cataract prone areas.
Yes.
These are Kenyans who don't have money. Now that His Excellency Governor Sakaja has put this eye hospital, which is a public hospital, you can imagine we are operating on an eye at a normal 25,000. Now, if you compare 25,000 to 180,000, the difference is way huge.
Almost free.
Completely. And for those ones who have NHIF, they don't need to pay any single coin.
Yes.
The NHIF pays for them.
Yes.
And they will not even be asked to make even a single top up.
Yes.
Unlike what happens in other private hospitals. So essentially, I'll say for Governor Sakaja, he might have thought of Nairobi alone, but yes, this facility, for the last 2 weeks we've been operating, it is treating all Kenyans. We are getting patients from Mombasa.
Yes.
Because as we speak in Mombasa, there is no eye hospital. If you speak in Malindi, there is no eye hospital. So whatever that is there is just a department inside the public hospital. And with a department, it is limited.
Yes.
It's limited in a sense of specialization. It is limited in the sense of space.
Yes.
It's like even us, when we were just having an eye department inside the hospital, we were limited. Because now we can only provide 2 consultation rooms for the 2 doctors. But now with an eye hospital, you have all range of consultation rooms. You are able to do almost you're doing more everything just under one space. So For the Kenyans, we have the capacity, and the beauty about it is Mama Lucy Kibaki Hospital is a teaching and referral hospital. Remember, we train for University of Nairobi, we train for Kenyatta University, and then we also train for JKUAT. So, in terms of capacity, in terms of manpower, the hospital is ready and it has all the capacity to manage. And we are also doing knowledge management and knowledge transfer, because like now for Dr. Judy, this is a rare specialization. To operate on a retina is a completely rare specialization. So by her being there, we are able to train other doctors also on how to operate on the retina. Because these are very delicate operations. These are very rare operations, and in nursing specialization, we have nurse ophthalmologists. Again, very rare. They are only trained at KMTC Nairobi. Now, the whole country, the only place where we are training nurse ophthalmologists is at KMTC Nairobi. For those who are lucky, they go through exposure training at Kikuyu Eye Hospital. For those who are lucky, they go to Sabatia. But these are Christian based facilities. So in terms of capacity to train, in terms of capabilities, it's not that much. But now with the Mama Lucy Eye Hospital, the capacity is there, because now you can imagine if we have 7 consultants. With 7 consultants, these are ophthalmologists. You have 4 optometrists, and then you have another 5 nurses ophthalmology. So in terms of even having time to train, having time to partner with people, it gives us that latitude. And so far, for the clients who have visited Mama Lucy Eye Hospital, they are very happy.
That's great. During the launch, Governor Sakaja, I think he paid for some about 1,000, or the first like 1,000 people.
Yes.
If that is true, then how do we get this 1,000? Do we just look at the line, pick the first 1,000, or we called friends?
Now, what I want to say is one thing is I'm so grateful for the support I've received from His Excellency the Governor.
Yes.
Indeed, I received 1,000 spectacles for the patients. And remember, during the medical camp, I had distributed 4,000 spectacles for free.
Wow.
So this is literally, this is a continuous exercise. And truth be said, Kenyans are going through hard times.
Yes.
And with these hard economic times, when someone comes has an eye problem and is able to be treated and gets the spectacles, that person for sure we've added a lot of value to their lives. How do we identify them? What we do is during when the patient comes to see the doctor, now it's the doctor who prescribes. The spectacles we are giving, these are reading spectacles. The people don't just have ability to read because their eyes have an eye issue, and they have an eye issue, they are not able to read. So for those ones who have had a reading problem, yes, the spectacles that we were given by the governor, we have managed to distribute them. Sometimes, government comes in to leverage. There are those now who have come with the NHIF card. Those who have come with the NHIF card, the NHIF will stand for them. Those who will come, they have cash, they are able to buy. Those ones they will buy. But now there are those ones who completely have nothing. Now those ones who completely have nothing, just the same way we do at the main hospital through the waiver process. There is the waiver process that is run through the waiver committee under social worker office. So we use the same method, and then we are able to solve so many of those problems.
Mradi huu umechukua muda mwingi sana kufika. It has taken a lot of time for such a thing to happen in the country or even in Nairobi. Do we say this was the right time? Why did it have to wait for all that time?
All these things happen, Manaka, because of one is you look at political goodwill, you look at creativity of the people at the time. Remember, I had just joined Mama Lucy, and then in the first month, I delivered the eye hospital. So all this just goes in of the processes that we've put in place, getting the right manpower into place. And the one thing that we bribed in with Governor Sakaja is he decided to take the CEOs to run the 4 big hospitals. Now, you know, as a CEO, you have a lot of expectations. There is people are expecting so much out of you. Strategically, we are supposed to position the hospital. So my role is simple. No, I don't see patients. My role is just to come look at the processes. How do we improve the processes? What other new things we can do? That's why we managed to put up that facility in less than 1 week, because the building was there. The building was there. It was built during NMS time, but then no one had furnished the place. So literally, what we did is we just came washed we just came washed the place, transferred some of the equipments that we were having in the main hospital, and then we didn't buy any single equipment. Literally, what we did is we just picked the equipment that was in the main hospital and brought them this side. We only bought a few. Like now, the operating eye microscope, that's one we had to buy, because now you are setting up 2 theaters. Then we had to buy the anesthesia machine. For the beds, we were having them. We were having them in the main hospital. So it was just a matter of reassemble and come and reassemble this side. So in terms of the staff, we were having these staffs were there before. The only thing that now that makes it a difference is before they didn't have consultation rooms, so wenyewe wanajipanga. So if we are supposed to be 4 of us on duty and there are only 2 consultation rooms, only 2 of us come, the rest wanajipanga. But now that the consultation rooms are there, all the 4 doctors must be seated in the 4 consultation rooms. All the nurses, they're supposed to be there. All the optometrists are supposed to be there. All the lab in the hospital, they are supposed to be there. So literally what we saw it that must have been derailing this process is just the mentality, the lack of plans. But now that tuko na mpango, na saizi hatuwezi sema mpango, tayari tushaanza kuifanyia kazi. So kwa sababu tushaanza kuifanyia kazi, and really Kenyans are seeing it. If it comes to the need, there was a need. Watu walikuwa na uhitaji. Kwa sababu kama tulifungua siku ya kwanza and we saw within 5,000 people, it literally tells you that there was a need. There's a need, there's a complete need for it. So ilikuwa inangojea tu mtu akuje aitanue basi. Yeah.
We have a number of eye ailments, eye conditions. In most cases, at your place there, Malusi Eye Hospital, majority of the patients come seeking what kind of service or what ailment. Majority are wanatafuta huduma aina gani?
Majority of the patients we are seeing, they are having glaucoma issues, sight. Of course, 90% of eye patients is because of refraction error. So for refraction error, we mean that people are not able to see. Maybe they are short-sightedness, they are long-sightedness, they have a light problem. So majority of the patients we are seeing now, they are coming with refractive errors. And of course the glaucoma issues. Now with the lifestyle diseases, the diabetes, the hypertension, all these contribute so much on the eye. So you will find so many patients who come, they are having diabetes, they are having hypertension. Some of them, they will come, they have the cataracts that now needs to be sorted. So we literally seeing all those conditions, but the one that is most predominant is refraction error. Yes.
During an operation, averagely, how long does an operation take?
15 minutes. Yes. For you to operate on a cataract, the maximum is 15 minutes. But if you are now going into the retina, definitely you will spend more. You'll spend 45 minutes, 1 hour depending on the multiple conditions. Normally, what we do for eye cataract, we cannot operate on both eyes same day. So we will operate on the patient today for one eye, and then give it time to heal. After 2 days, we operate on the other eye.
We need to take a short break, but when we come back now, we are going to engage the public who are also listening. We'll give them time to ask us a few questions because we have you here and there are so many issues that they are interested in knowing.
Thank you.
Welcome back. We are still discussing health na leo tuko Mama Lucy na tuko na the CEO here. Na tulipokuwa tunaenda break kulikuwa na ujumbe zilikuwa zimeendelea kukuja hapa. Remember, if you are also following us up here, all the questions that you have, you can share. The doctor is here will answer what he will be able to. For example, I have somebody here saying, hello, ask the CEO Motano. We have been hearing negative stories of the hospital. How and what different things has he put in place to change that image? I'm Mercy from Kayole. Then tuko na mwingine nasema, Bwana CEO, thanks for coming. Kindly tell us how as the community know more about the eye problems and prevent this.
Thank you, Mercy from Kayole. One thing is, I think for the last 2 months, you've not had any negative story. Yes, I think for the last 2 months, what we've done is we came up with a quite robust security strategy within the first 1 week. We have come up with a quality management system just to ensure that the services we are giving are up to the standards. There's a lot of process re-engineering that we have done. Like just an example, even when I'm here in this studio,
Yes.
I can tell what is happening in my hospital.
Wow.
On my phone. So those are some of the processes that we've put in place, so that when if someone has not come on duty, knows that Dr. Wafula will know, because I have CCTV on my phone.
Oh, okay.
So at any given time, if there is a queue, I'm able to see. See, like now, that's maternity.
Oh.
And you see how now the hospital is very clean.
It's like real time.
Yes, real time.
Wow.
That's great.
Completely real time. So these are some of the things. These are some of the things that we have put in place. And now you can imagine, this is not the Mama Lucy we used to know. It's completely different. So those are some of the process re-engineering that we've put in place. We've ensured that in terms of supplies, there is constant supply in conjunction with the health facility, chief officer health facility. So we just ensure that yes, there is supplies. I think you've not had any of my staff complain that they have not been paid. By 30th, kila mtu ana mshahara. So that's why you find all of them are motivated. And I think we are the only hospital that celebrates people's birthday. We did it in the first week, and now we are doing it every month. So there's quite a lot that has come into it. Like as we speak now, there's a training starting at 10 on what we call auto transfusion.
What is that?
On auto transfusion, you know, this country has a problem with blood.
Yes.
Our blood bank doesn't have enough blood. Of course, when you look at the supply of blood versus the demand is higher than the supply.
Yes.
So what we've done is we've come up with a new procedure where if you're operating on a mother, you're able to recycle her blood.
Yes.
You see, during a theater, someone will lose 4 liters, 3 liters of blood. But now with the hemophils, you are able to recycle at least 60% of the blood. And the beauty about auto transfusion is you not have issues of blood reaction, rejection. You not have issues of infection, because yani ile damu yako yenye inatoka ni ile tunakurudishia. So that's going to really part of, we will not say we are going to have a complete solution, but at least now we are moving towards managing blood shortage. Apart from that, for the people who have had laparoscopy surgeries, operating on the stomach,
Yes.
you will find you go to be operated, you are admitted for 4 or 5 days.
Yes.
But now what we've done is in collaboration with the OTPAC. OTPAC is Operation Theatre Kenya, and also Surgical Society of Kenya. We have started gas and gasless laparoscopy. Now, for the people who have the gas and you have let's say an issue inside your stomach, we are not dissecting any longer. We drill, and then you go in with a pipe. You are able to push aside the contents. Then you operate on the site of the problem. Then you release the patient in less than 48 hours. So these are so many of things that last week when I joined, I found a backlog of surgeries. If you came to Amalusi for a surgery, you will be booked 2025. Now you can imagine you have goiter, you have a hernia, you have hemorrhoids. Unafika unapewa mwezi wa sita tarehe 28 2025. So these backlogs, what we've started to do now, we are in collaboration with JQuat. Last week we operated on 180 patients, so that now we reduce this length of waiting. The same thing we have done for people who come for medical assessment. For medical assessment, again, you'll be booked to 2025. But now what we have done is, with a partner, we got a partner, Help Initiative Kenya. They paid for us. We got more manpower, and then now we have reduced that, so that at least now, if you come, your next booking will be in 2 months. But our intention is to work around board, so that we reduce this waiting time completely for patients who are coming seeking for the surgical procedures. The same thing we are going to do it on Saturday this week with KMA, Kenya Medical Association. We are going to have a medical camp. The likes of Dr. Monda will be there. These are very rare. Is a very rare. Getting him is not easy, because this is a hematologist, and in Kenya they have less than 20 hematologists. But then what we are doing is collaborating with other stakeholders, so that then we find a way on how do we make the system efficient. The beauty about it, once Mamalusi is efficient, Kenyatta National Hospital will be efficient, because now the patients that will have gone there, they will be sorted at Mamalusi. Yes.
Yes, Peter from Umoja is saying we need such discussions to change our health system. I'm liking it already. The CEO sounds promising. Then Jen from Dandora is saying, hello, ask Dr. Afola. We heard about the eye hospital launched recently. Does it accept other insurance services such as NHIF?
Yes, for the eye hospital, that's Jane from Dandora. Yes, we accept other insurances. We accept NHIF, we accept Jubilee, and we are also in paneling other insurances. To Peter, one thing that we have to, and I think I'm so delighted that Malachi saw it fit for us to have this conversation. It's a continuous conversation, because one thing of improving the quality of service is by having these conversations. This is part and parcel of public participation. So as a hospital, yes, we are set to having this conversation with the community. I think this is the third media house that now we are now engaging with. We've had an engagement with the MediaMax. We've had an engagement with KBC. Now we are here on Fango Radio. Now, one thing that I'm really delighted is this is the first radio show I'm holding. Otherwise, I've just been on TV. So this is completely continuous. For the people who have eye problems and they are not able to come to the hospital, we have our mobile. We have our mobile clinic, the one that President Uhuru started on Beyond Zero. So we have been allocated that vehicle by His Excellency the Governor. So So what we are doing is we are in conversations with MCS and members of parliament, so that then we organize with them. We go to their community. You know, once you start organizing with these leaders, you avoid costs, unnecessary costs of hiring tents and all and what have you. We'll use the public facilities. We use the health centers, the dispensaries, the schools that are there, so that then we take the service to the people. They are screened there. The beauty about the mobile clinic, it comes with everything.
Yes.
It comes with everything. It comes with the lab. It comes with the doctor. It comes with the machinery. So that then we are able to screen as many as possible. We are able to tell. Recently, through the Office of Chief Medical Services, we have started a community eye program, where now there is a link between the public health officers, the community health promoters, and the public eye, the community eye centers. So that when they are moving around through the community health promoters, we are able to identify these eye problems. We are able to locate them, and the people are able to be assisted. Remember, Nairobi County has employed 7,000 CHPs. These CHPs, their role is to take care of, each CHP is taking care of 100 homes. Now that means if we are talking about 7,000, literally we are talking about around 7 million homes. So with those homes, majority of these problems we are identified, and that's the reason why at the Mama Lucy Eye Hospital we are seeing over 300 patients every day.
Yes.
Because now these community health promoters, they are doing a marvelous job. They are doing a really good job. Of course, as a government, what we have deliberately decided on is we also don't delay their stipends. At least for the first time, I think in our time, these guys are able to get something.
I'm Dan from the Goreti Health Center. This is a great discussion. I have listened to the CS speaking. I think it's the one the hospital needed to be reinvented. I hope he does what he is speaking about. We wish him well. We need such officers in the public hospital. Commendation.
Thank you, Dan from Dandora. Of course, one thing is
From the Goreti.
Dakoreti. Is Dan from Dakoreti. Thank you so much for the observation, and I believe we are equal to task, and that's the reason why you're seeing things are moving. At least in the first 1 month, we were able to do the eye hospital. We have also finished the orthopedic and trauma center. I'm finishing the wound care and the plastic surgery area. If you come in the hospital now, we have completely decentralized the reception. Reason being, there was a lot of congestion around there. We have increased the number of the doctors. I'm now setting up and if you come at the emergency and the accident, there is construction going on because we want to do an emergency laboratory. The reason why we want to do an emergency laboratory, when you come into accident and emergency, you should be just treated there. Another very beautiful thing, that's why probably you might not be seeing issues of patients passing on, is we've put some ventilators at the emergency and the accident. There are 5 ventilators at the emergency and the accident, so that our ICU is 4 beds. So with 4 beds ICU completely, we are not able to serve all the Kenyans because we are already overstretched. So what we've done is we've set up a mini ICU at the emergency and the accident, and I assure you, it is really solving so many Kenyan problems. Inside the emergency and the accident, I've also set up another theater. So at the emergency and the accident, if my 4 theaters are completely occupied and the patient has come in, we are able to operate that patient at accident and emergency. And those are the reasons why probably you find whatever Jane was saying is no longer coming up, because we are able to arrest it there and then. Yes.
So the issues of with your improved security, the issues of children getting lost.
You never see them. You never see them. Of course, one thing that we do And not forgetting, I also have a background in security and intelligence.
Uh,
So it gives us the G's on how do we manage it.
yes.
And with a mild security agency plan, we are able to manage. If you go to the hospital now, you'll find 3 armed police.
Armed police
Yes, you have 3 armed police,
carrying people.
and then we have our civilians
Yes,
inside,
yes,
and then now the private contracted security firm.
yes, yes,
Reason being, remember we are taking care of 3,000 Kenyans every day.
yes,
If you are taking care of 3,000 Kenyans every day, our security plan should really solid,
yes,
completely solid, and that's why probably all those things are no longer coming.
yes, yes,
And there are those issues of people who come and pretend to be working for Mama Lucy
yes,
and then solicit money from the patients.
yes,
They are no longer happening because at Mama Lucy now you pay by pay bill number.
yes,
So if someone asks you cash, that is a thief. We get hold of him because as we don't know any other language.
Yes.
If someone asks you money, whether it's a staff or it's not a staff, that is a thief. And we have a way of managing thieves
yes,
completely. And even my staff know. You pick money from a client,
Yes.
I'll get to know, and immediately I get to know, unamwaga unga,
yes,
then there is no other option. Yeah, completely there is no other option. Because you know, we are paying on time. We are not having issues of salary delays. If the staff needs motivation, we will put good motivation plans in place. So ani mtu hana lingine kabisa, but just to serve the Kenyan. The same way we are also diligent in paying on time, in ensuring that they have the necessary tools and equipment that support them.
Yes.
So all those things currently, and as I told you, the CCTV is on my phone.
yes,
And apart from it being on my phone, I'm setting up a control room
Okay.
where people will be seated the way we are seated and they are monitoring. So anything fishy, we are able to pick it
Yes.
real time.
Yes.
And that's the reason why we partnered with Kenya Police.
yes,
We partnered with civilians.
Yes.
The role of the civilian is to interact with the people and get to know what is happening.
Yes. True.
now define the job description of a doctor. Is it just prescribing and then they let somebody go and do implement it, maybe a nurse to go and do shindano, or do they are allowed also to treat while in that room?
They are allowed to treat while in that room.
Yes.
You know the scope of work of a doctor. One is to listen to the client, come up with a provisional diagnosis. Probably say this person might be suffering from malaria, or this person might be suffering from diarrhea. So once he has come up with some 2-3 diagnoses, because we are allowed to have at least 2-3 diagnoses, then you put a lab request. So it is the role of the doctor to write a lab request. Then this patient goes to the lab to be tested, so that then the doctor wants to rule out, is this person suffering from malaria, is this person suffering from cholera, what is this person really suffering from. Now after the lab results have come, now it is the role of the doctor to prescribe medication. So once he has prescribed medication, now you hand over to the nurse to administer the medication. So the nurse might maybe you've said give an injection,
Yes.
or give an oral, or you prescribe an admission,
Yes.
because also the doctor can prescribe an admission to admit the patient, or you prescribe a surgery. So assuming this patient has come with the low abdominal pain, and then you suspect is has appendectomy, you ask for an X-ray. Once you see the X-ray, you are able to see, okay, this is an appendix. So with an appendix, there is no medication. The medication is theater. So the doctor prescribes surgical. And then the same doctor goes sees the patient in the ward, and then the nurse takes the patient to theater. The doctor operates on the patient.
Yes.
So it's a complete teamwork. It's a complete teamwork. But of course, all this rotates around one person, the doctor.
Yes. But there's a concern here about do you have any plan? Do you work on a plan, like a strategic plan And if so, if you have one, what's its validity? What's its validity?
We have a strategic plan that ends 2024. Today, as I did indicate, after this, I'm going to Naivasha with my management team. The part of what we are going to do is review of our strategic plan. Of course, the reason why we have to review our strategic plan is things keep on changing every day.
So,
And for corporate governance, you can't manage without a plan.
that's true.
It's just like, when you don't plan, you plan to fail.
Yes.
That's true.
So, yes, we have plans. In the meantime, what I've done is we've come up with a short-term plan.
Yes.
What we are calling it strategic key points, key priorities. And so far, we are implementing. Part of the strategic key was we were looking at quality of care, we are looking at cleanliness, we are looking at security,
Yes.
we are looking at availability of medication, and then training of manpower. So those are among our first 5 things that we are now working on.
Yes.
So as we proceed, those are some of the things that now we are able to expand on. As I did indicate, we have been tasked to do centers of excellence, and we have already done 2 now.
Yes.
We've done the orthopedic center, we've done the eye hospital. This month, we intend to do the first ENT hospital, and I think it will be the first in Africa,
Oh, okay.
just for ear, nose, and throat.
Oh, okay.
We are also doing an oncology center at Hurlingham. So literally, we've put deliberate plans on board.
Yes.
And one of the things that I always pride in is we have a very dedicated board. The hospital has a management board,
Yes.
being led by Madam Dorcas Kemunto. So, with the management board, the CEO is put into checks and balance.
Yes.
True.
So, because I have my board, and then I have the Waziri and Madam Selinton.
Yes.
So I have Waziri, and then I have my board. So my board has to ensure, and remember, this board is constituted of residents of Nairobi.
Yes. Yes.
So the Nairobians are the one running the hospital. The role of the CEO is just to give a strategic position, give a strategic decision, and then now the role of the board is to guide. Is to look at if we've put in this plan, has it worked as planned? So, and so far, for the last 2 months, we've really worked tirelessly together, and that's why probably some of these fruits are coming up.
Yes.
Maternal, newborn, and the child health. How many pediatricians do you have? There's a time we would have Dr. Hira moving from Nairobi Hospital to Pumwani, Gatewood, all the hospitals. How many doctors do you have today?
We have so many doctors. In a nutshell, Mama Luisa Hospital has 58 consultants.
58.
Consultants. These are people who have read books beyond Form 4. They spend another 18 years. Another 18 years. If you come to Obsgyn, we have 5 Obsgyn. Among them, one of the most sought Obsgyn, Dr. Mondi. This is a gyna oncologist.
Who was at Pumwani? Dr. Mondi was at Pumwani?
Yes, was at Pumwani.
Yes.
And then we took him to do oncology.
Okay.
So now he's a gyna oncologist. Now you can imagine, we didn't have doctors who are just specialized in cancer treatment. Now Omondi is able to manage cancer and is also able to manage gyna and obstetric issues. And for the first time, Malakai, in history, we've started the first Obsgyn clinic for men.
For men also?
Yes.
Wow.
So many people never thought that men need the Obsgyn services. As we speak, so many of us have prostate cancers.
Yes.
How do we get them managed? So many of us have constrictions and strictures. How do we get them managed? As we speak, there is a lot of resistance UTI, and it's affecting men. There is a lot of infertility. Now, this infertility doesn't only affect women; it also affects men. But now, was there any hospital offering specific Obsgyn services for men? There was none. So what we've decided at Mama Lucy is boy child is also a child.
That's a child. You've not forgotten about that. All the campaign is all about a girl child.
Yes. We support them. The only thing we've done is for the male obstetrician clinic is run on Mondays.
Oh.
It's run on Mondays by Dr. Samuel Mutumba.
And how many turn up? How many?
Huge. You know, the bit about it is immediately you set up such a kind of a clinic,
Yeah.
stigmatization
Yeah.
is resolved.
That's all.
People fearing that someone will see me going to the hospital is resolved.
Yes.
The person just knows that as I go to the clinic, I'm going to meet with men.
Yes.
So I'm not going to meet with female.
Yeah.
I'm not going to be mixed by female. You know. So those kind of fears, we have now managed them. So that's why we deliberately set up a clinic just purely for men gynae issues.
Okay.
Wonderful.
Wonderful.
Actually, you've done well. And what's the next big thing that our listeners
Now that in 2 months you've done all this, where do you see Mama Lucy Hospital at the time you'll be exiting, or if maybe the next 5 years? Where do you want it to be?
Mama Lucy Hospital, one thing that I've deliberately made a decision is to create Mama Lucy Hospital as a center of excellence. And of course, one thing that we want to do is as we set these other centers, literally we're improving the quality of care. Let's have a Mama Lucy Hospital that is equivalent to Aga Khan.
Yes.
Let's give it a facility that is equivalent to KU Teaching and Referral Hospital. So that the Kenyans who come to be treated in a public hospital, let them not be different like those ones who are going to the private hospitals. We want to set a public hospital in the same format as a private hospital. Of course, if you go to South Africa, and you look at the way South Africans have set their health facilities, if you go to Singapore, if you go to Malaysia, and you know these are junior countries to Kenya, but then these guys have set up a public health sector that works for its people, and that's literally what we want to do. Look at China. China has the largest population in the world, but they have the best facilities. Look at India. You can imagine India is younger than Kenya as far as independence is concerned. But we are taking our people to India. At what cost? You know, a procedure like now, hip replacement, if you go to India, someone is going to spend 1.8 million. If when we're doing it at Mama Lucy, it's 400,000. So complete difference. So one thing that we are destined to do is set a public hospital so that everyone loves.
But everyone loves.
That's why when you come there is no more smell.
You enjoy yourself.
Yes.
You enjoy.
Completely. You yourself, people are happy serving you, and that's what we are now destined to do.
That's great. Universal health care. Just your own assessment. Are we on track? Is Kenya on track to see?
Yes, indeed. As a health specialist, yes, Kenya is on the right track so far.
What have we done?
As we speak now, especially now when we start with the new acts, the 4 acts, the Digital Health Act,
Yes.
the Public Health Act. There are 4 acts and then Facility Improvement Fund, and then the National Social Health Insurance Act. When you look at these 4 acts in reality, of course, as a country, the first thing that any country starts with is by formulating the correct laws and policies that support a given agenda. So with the universal health coverage, already with the 4 acts, already the program is well covered. As we speak, when you look at National Health Social Fund, this is a big thing for Kenya. The burden of care is normally financial, and people say you are just one sickness away to your poverty. So having an NHIF card that you can pay, imagine it, just pay 300 shillings under national scheme. If you pay 300 shillings, and then you yourself, your wife, and your children are covered, that literally means in a year you are paying how much? You are paying around 3,600. Now with 3,600, and you are completely assured of your health.
The second NHIF is only covering bed.
No, it doesn't only cover bed.
Yes.
All these surgical procedures, it's NHIF that pays. When someone comes with the NHIF card and has a fracture, we just pre-auth to NHIF, then it covers. Look at this program called Edu Afia.
Yes.
All students. In fact, immediately the child is at school and has a NEMIS number. The parent forgets about paying for their medical bills until the child has cleared Form 4. That's a big thing. Look at this program on elderly.
Yes.
The ones that the government is paying something for them,
Yes.
and every month as they remit their money, they are also paying for NHIF. These are people who have ailments every day, and with this they are sorted. Now look at the facilities. From Mama Lucy Hospital to Umoja Health Center is 1.6 kilometers. Literally 1.6 kilometers. From Mama Lucy Hospital to Mama Lucy Eye Hospital is 800 meters, which is literally 2 to 3 minutes drive. From Mama Lucy Eye Hospital to Umoja Health Center is 2.5 kilometers. What does WHO require? From one hospital to another 5 kilometers. We are less than 2 kilometers from each facility. So in terms of access, the government has put it in place. Look at availabilities of doctors. At Mama Lucy, we are talking about 58 consultants at disposal. If someone went to Metropolitan Hospital or any other private hospital to access a consultant, it's not less than 2,000. At Mama Lucy, it's less than 300. And then you're going to get all the treatment there. If it comes to access to medication, all the health centers, through a chief officer health facility, all the health centers now have drugs.
We don't. Okay, there's a case at Mama. It used to be where you prescribe a drug. I go to the pharmacy to buy. I would be given some few, but I'll be referred to some clinic, not clinic, but
A pharmacy somewhere.
yeah, to go and buy it from there.
What we've done in the last 2 months is
A chemist. Yes.
what we've done is right now we are stocking our pharmacies using essential package.
Yes.
You know, there is a Kenya essential package that the government has designed that now all the public hospitals must have these essential drugs.
Yes.
Apart from that, I'm coming up with another plan that now will stock now those that are not within the essential package.
Yes.
So literally what we are going to have is a complete pharmacy system that works, so that the doctors are not able to give you the prescription to go and buy outside. Of course, these are systems that have worked in other countries before. If you go to Tanzania Muhimbili Hospital, there is no chemist outside the hospital. And these are government, these are national hospital. Because now with the plan we are able to have the essential drugs, and then we will have these other original drugs available within the facility.
Yes.
The beauty about that is if you will have bought the drug at 100 shillings in a pharmacy outside, you will be able to buy it at 70 or 50. Because this is government, and government doesn't transact business.
Yes.
What government does provides service.
One listener from Ngong called Pamela is asking, Lisa Daktari, some of the members of our family have a condition called retinitis pigmentosa.
Yes,
Can it be corrected?
it's the one we are talking about operating on the retina.
Yes.
By Dr. Judy.
Oh, okay.
So we are doing it. We are doing it at Mama Lucy Eye Hospital. Let her come.
Okay.
The hospital is open every day, Monday to Friday, 8 to 5. Yes.
Paul from Pika is saying, they see, congratulations, Mr. CEO. That is a good start. Now, the only thing is wondering is how you are going to build, to win the public perception, confidence. Now that already the name Mamarusi Kibaki, the hospital has had bad reputation in the past, bad stories, headlines in the past. So how are you going to restore people's confidence?
As we speak, those patients who have served, they're happy. You only some of these things happens by giving a good service. So whatever we're doing is just ensuring that there is a good service given to the client, and then having such a kind of forums, where we can interact with the public. And there's quite a lot that we are doing in the background. Apart from now these radio shows, TV shows, we are engaging with the community. And I think last week you saw Pumani Mashinani. And when you're having such a kind of plans like now Mama Lucy Mashinani, you're going to interact with a common citizen. And that common citizen will tell you, I've had this problem. Just like now from the caller in Gong.
Yes.
If we didn't come here, that person could not have known that retinal pigmentation is a condition that can be treated at Mama Lucy Hospital. But now that we have started interacting with the people, sometimes people will have perceptions that are not real. Someone just talks about it. Like now, people didn't know. People didn't know that we have pediatricians at Mama Lucy Hospital. People didn't know that we have obs-gyns. People didn't know that we have a male clinic. But now people are now able to know. And so the beauty about it is once people are able to know, and then they come seek the service, and they actually get the service, definitely perception changes.
Another one is ask the CEO, what about drugs mtu anatibiwa naambiwa nunue dawa huko India has this one you answered this. Maybe you have to scale.
Yeah, I think on the drugs, what we've done as at now, we are providing all essential drugs, the ones that are in the essential drug list by the government. I'm working on another plan to expand. What we are coming up is we are coming up with the hospital formulary. Now, hospital formulary is not a formula like ile mathematics. What happens is all the doctors sit and then say, for me, Dr. Wafula, I like prescribing these drugs. Dr. Rashida, I like prescribing this. And then now we collect that list. So that what happens is, from the hospital formulary, we ensure that what is in the hospital formulary is stocked. So no doctor will write a prescription of the drug that is not in stock. Because that doctor is the one who came up with the hospital formulary. But now from this list, let's procure this. What will happen is, if you're talking about augmenting 625, what will ensure is at least we have 3-4 brands of augmenting. So if the doctor likes GSK, we'll have GSK. If the doctor likes ABC, there will be ABC. So that then we have no reason of someone having a prescription card in their consultation room. So that's what we are working on. But as at now, what we are providing is what is in the essential drug list.
Thank you. We are just about to end, and maybe my colleague has one more question.
No, I think what I may ask is that condition you just talked about tonight. How long does it take to correct?
One thing is, until you see the patient.
Yes.
Until you see the patient. Yes. Is now when you can be able to tell the severity. Different patient will present differently on the same condition. So depending on the severity of the condition, we will be able to manage and advise accordingly. So I think
she says brain to write.
Oh, she says brain to write. Yes. No, but one thing that we can ask her is let her visit the hospital, meet with the consultant, and then from there the consultant will be able now to tell. Yeah, because these are one is it some of these conditions are very delicate, The operations, as I told you, these are some of the operations you can be in for 1 hour. And then depending on the severity on the retina, how the pigment has destroyed the retina, now you can be able to tell for how long you will be able to salvage the issue. Yeah. So we just need the person to visit. Let's know the stage at which the condition is. Then we will be able to advise accordingly.
Thank you. Now I'll give you time for a parting thought for anything that we left and you still need you think the people should know as we wind up.
Thank you so much, Pampo Radio, for availing this opportunity for Kenyans to interact with Mama Lucy Kibaki Hospital. We are here to build together, and that's why we come out to get the feedback. So you're most welcome at Mama Lucy Hospital, and I always tell people when you are there and you are not served, just ask the CEO's office. I'm always in office from as early as 6 up to as late as 10. So, and they know that once we are there to serve Kenyans. So any Kenyan from any place, might it be Nairobi, might it be outside Nairobi, and you feel like you need a service that is available at Mama Lucy Hospital, you're most welcome. We are waiting for you to serve you. Our role is just to serve you. Thank you so much, and I think to Nairobians, we are grateful for the leadership that we are getting from His Excellency the Governor Sakaja, and to my board members being led by Dorcas Kemunto. We are really grateful for the oversight that you offer, the insight that you offer, the tireless nights and days that we spend together to ensure that we're putting a facility of its kind for Nairobians. We are very grateful. Na kwa wale ambao wanaumwa, poleni sana, ila karibu Mama Lucy tukutolee ugonjwa.
Thank you so much. That is, we've heard, our listeners have heard it all. Unless Mwagonya has something to add, we come to the end of the show. Till next time, bye bye.
Thank you very much.